Respironics Total Ventilation Solutions give you the knowledge to make decisions like these across the entire continuum of ventilated care, from arrival to discharge. This is one patient's story. Because Robert is short of breath, paramedics use a handheld pulse oximeter capnograph, the tidal wave, to quickly determine his status. He's diaphoretic and cyanotic and suspected of an acute exacerbation of COPD. The ER nurse transfers him to our Cosmo monitor to verify critical ventilation and oxygenation data and track his progress. Since the Cosmo unit is lightweight and portable, she'll be able to continuously monitor him as he moves from the ER to the OR or the ICU. Robert's condition deteriorates. Even with increased oxygen, his O2 saturation is only 81. His attending physician decides to use the BiPAP Vision, the standard in non-invasive positive pressure ventilation, with advanced features like oxygen mixing, waveforms, and comprehensive alarms. Robert is fitted with a Respironics mask, one that's not only comfortable and easy to use, but works in concert with our non-invasive therapies. In fact, BiPAP Vision includes auto-track sensitivity to compensate for any mask leaks. Plus, it automatically adjusts sensitivity and cycling to each patient's changing breathing patterns. As with the tidal wave, the Cosmo monitor can be used with a nasal cannula or as a mainstream system. In Robert's case, the mainstream CO2 sensor monitors end-tidal CO2, showing an elevated level at 72 millimeters of mercury. With the support of BiPAP Vision, Robert is breathing easier. But his X-ray reveals that he has bilateral infiltrates, so his doctor orders another blood gas to confirm the elevated levels of CO2. The levels are still high, and Robert continues to be tachypnic. The doctor and therapist decide to move him to the ICU. Since his condition hasn't improved, Robert will be intubated, and his work of breathing will be transferred to the ventilator. Robert is intubated and placed on the Esprit ventilator with non-invasive and invasive modes and an intuitive touchscreen interface. Esprit delivers the high performance needed for the most critically ill patients. To gain a more balanced view of Robert's respiratory status, his clinical team decides to monitor him with Respironics NICO. This non-invasive cardiopulmonary management system integrates volumetric CO2, its derivatives, and cardiac output in a single device to take the guesswork out of ventilation management. NICO measures the amount of CO2 eliminated on a breath-by-breath basis and reveals the volume available for gas exchange. It gives you a way to follow continuous CO2 elimination so you can assess ventilation efficiency. One parameter used to evaluate Robert while on mechanical ventilation is VDVT, the ratio of dead space to tidal volume. This index measures the portion of each breath that doesn't participate in gas exchange, an important indicator of the severity of lung injury. Robert's therapist enters the results from the blood gas analysis on the NICO monitor to obtain a value for VDVT. His reading is 0.7, outside the normal range. Using volumetric capnography and its derivatives, she determines the severity of illness and optimizes the ventilator settings. Thanks to the NICO sensor rebreathing loop in the circuit, she's also able to evaluate the effects of positive pressure ventilation on cardiac performance and make adjustments. Slowly, Robert recovers. His volumes and pressures look good. Volumetric CO2 is stable, and the end-tidal is down to 49 millimeters of mercury. The ICU nurse continues to assess the trend in his vital signs and observes the trended O2 saturation, end-tidal CO2, and the respiratory pattern. The therapist draws an arterial blood sample to gauge Robert's progress. 2 days later, lab results show the blood gas values have improved significantly. VDVT is now 0.49. The doctor and the nurse plan to wean the patient from the ventilator, aided by volumetric CO2 monitoring. They can decrease the number of mechanical breaths or progressively increase the periods of spontaneous breathing off the ventilator. Either way, NICO provides vital respiratory monitoring needed to ensure patient safety and guide the weaning process. By measuring how much CO2 is eliminated by the lungs in the face of changing mechanical support, His clinical team gets an instant indication of Robert's ability to breathe on his own. NICO trends indicate that Robert is maintaining his CO2 elimination. It's now safe to extubate. The hospital staff has done its job, and so have Respironics Total Ventilation Solutions. While this is just one patient's story, Respironics offers you all the products, programs, protocols, tools, and technology you need to manage the respiratory care of every patient, every hour, every day.